Good evening again, and thank you for joining us. Please welcome Senator Bernie Sanders, Chairman of the Senate Health, Education, Labor, and Pensions Committee. Representative Pramila Jayapal, Chair of the Congressional Progressive Caucus. President Nancy Hagans of National Nurses United. Dr. Adam Gaffney, Dr. Sanjeev Sriram, Dr. Natasha Driver, and Jennifer Coffey.
Love you too. All right. Let me thank all of you. This is a great turnout, and I thank you all very much for coming out. And let me especially thank our doctors and nurses who are here with us today. I thank you very much, and the American people thank you for the work you do every day, keeping us healthy, saving our lives. And I want to say a special word about the work you've done during the pandemic. You are true heroes and heroines. We have, and today, at this moment, we remember, we honor the many, many thousands of doctors and nurses who gave up their lives trying to keep their patients alive. And that's something we will never forget. And let me thank Representative Pramila Jayapal, the leader of the Congressional Progressive Caucus, who is leading the fight in the House with great success for Medicare for All. And let me thank all of our panelists, who I'm going to introduce in a few moments. But before I introduce the panelists, I just wanted to make a few points. Number one, the current healthcare system in the United States is totally broken. It is totally dysfunctional, and it is extremely cruel. We can no longer tolerate a system which spends $13,000 for every man, woman, and child, twice as much per capita as do the people of any other major country. We cannot continue a system in which, despite all of that spending, 85 million Americans are uninsured or underinsured, and you guys see them every day walking into your offices, where 1 out of 4 Americans cannot afford the prescription drugs their doctors prescribe. And what the system does not talk about, over 60,000 Americans die every single year because by the time they walk into the doctor's office, it's too late. What an outrage. We cannot continue a system in which our life expectancy, how long we live, is lower than almost every other major country, and above and beyond COVID, which certainly was a disaster for this country. Above and beyond that, our life expectancy is actually declining, and in this healthcare system, working class and lower income Americans die 10 years earlier than wealthy Americans. Can you believe that? So poverty is a death sentence. Whether you have access to decent health care, you live or you die. We cannot continue a system in which large parts of our nation are medically underserved, medical deserts, where rural hospitals are being shut down, and where people, even with decent insurance, have to travel hours in order to find a doctor. This is America, traveling hours to find a doctor. We cannot continue a system in which, in the midst of a major mental health crisis, Americans are unable to find the affordable mental health treatment they need. We get calls all of the time in my office. I suspect every senator does. Senator, we've got a crisis, my husband, my wife, I can't find the kind of mental health counseling I need. Can't afford it. We cannot continue a system where millions of senior citizens have no teeth in their mouths, cannot afford dentures, they can't afford the hearing aids they need or the eyeglasses they need. And this is after spending twice as much as any other major country on earth. We cannot continue a system where, despite all of our expenditures, we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough mental health professionals, we don't have enough pharmacists and other healthcare professionals. We cannot continue a system in where we spend less than half of what other countries spend on primary health care, the means by which we keep people healthy and out of the emergency room and out of hospital. We cannot continue a system in which, while we are in desperate need of more healthcare professionals, young people are graduating medical school, dental school, and nursing school hundreds of thousands of dollars in debt. I mean, how insane is that? Desperately need doctors and nurses. Say, good, you want to go to medical school, you want to go to nursing school? Good, you're going to come out deeply in debt. We can't continue a system in which Black and Latino and Native American doctors and nurses are grossly underrepresented as medical professionals. I was just at Morehouse University Medical School last week and talking to the folks there. About 13% of our population is Black, 5% of our doctors are Black. Same thing with nurses, same thing with Latinos. We cannot continue a system where doctors and nurses spend half of their lives arguing with insurance companies as to the kind of care they should provide. Doctors and nurses should make those decisions, not insurance company bureaucrats. We can't continue a system where patients have to fight their way through a complicated system of premiums, deductibles, co-payments, networks, and Byzantine forms as to what kind of treatment they should get. We cannot continue a system in which health care is attached to your job. Think about how crazy it is that during the pandemic, millions of people lost their jobs. That's pretty bad. And on top of that, because their health care is attached to their jobs, they lost their health care as well in the middle of a pandemic. It is totally absurd that the quality of care an American receives in this country is dependent upon the generosity of your employer or whether you have a union. Workers at McDonald's deserve the same quality care as executives on Wall Street. Let me be as clear as I can be. The function of a rational and humane healthcare system is to provide quality care for all as a human right. It is not to make tens of billions of dollars every year for the insurance companies and the drug companies. So yes, it is long overdue for us to end the international embarrassment of the United States being the only major country on earth that does not guarantee health care to all of its people. Now is the time for a Medicare for all single-payer program. And let me be very clear, and I say this here in the halls of Congress. The debate over health care and over Medicare for all has nothing to do with health care, because the current system cannot be defended, and in fact, it very rarely is defended. You don't have too many people getting up there on TV saying, oh, man, we got a great system. That doesn't happen. What the debate over health care in this country is really about is the extraordinary greed of the healthcare industry and their desire to maintain a system in which they make huge profits every year. That is what we're really talking about. While ordinary Americans struggle to pay for health care right now, the health insurance companies in our country made over $69 billion in profit last year. Think about it. People can't go to a doctor, they don't have any insurance, they're dying, they're getting sick. Insurance companies make $69 billion in profits last year. Pharmaceutical industry last year, the top pharmaceutical companies made over $112 billion in profit. And their CEOs make unbelievable compensation packages. So in other words, the healthcare system is doing just great for the people who own the system, but it is failing ordinary Americans. Let's also be very clear in terms of what we are taking on. In order to defeat the Medicare for All movement, these powerful special interests have spent tens of millions of dollars on 30-second TV ads, full-page magazine ads, and corporate-sponsored studies to frighten the American people about Medicare for all. And by the way, that's exactly what happened in the 1960s when Congress passed Medicare. You'll remember, or you've read about, socialized. Medicare was socialism. Today, of course, Medicare is the most popular health care program in the country. So what we're looking at is an industry that has spent billions of dollars on lobbying, campaign contributions. Right now, as we speak, this moment, right here on Capitol Hill, the pharmaceutical industry has over 1,800 well-paid lobbyists. 1,800. There are only 535 members of Congress. I got 3 lobbyists for every member of Congress. Former leaders of the Republican Party, the Democratic Party, are swarming all over this place. So where we are today is not complicated. The American people understand this system is failing. The American people understand that health care is a human right. And our job is to bring our people to finally end a disastrous system and make it clear that every man, woman, and child in this country is entitled to health care because they are a human being. So I want to thank you all. I want to thank all of you because you work really hard every day. But you also understand that for you to do your jobs well, we need to change the system. You don't want to continue a system where people walk into your office much sicker than they should have been. So I thank you very much. And this is a struggle that we are going to win. If not today, we will win it tomorrow. And we will win it because of the extraordinary efforts that you all are making. So I thank you very, very much. Now it is my pleasure to introduce to you Representative Pramila Jayapal, Chair of the Congressional Progressive Caucus.
Let's give it up for Senator Bernie Sanders. I never get tired of listening to Bernie Sanders because he tells the truth every single day. Thank you, Senator Sanders, for leading us in this movement. Thank you for popularizing Medicare for All during your presidential campaigns. We would not be where we are without that effort. And I am so proud to be here as the lead sponsor, along with Representative Debbie Dingell in the House, for the Medicare for All Act of 2023, which we will introduce tomorrow. And I want to start because I've been an organizer before coming to Congress for 20 years, and so I want to thank you for building this movement for Medicare for All. We would not be here without you. We would not be here without the healthcare professionals, the doctors, the nurses, the providers, the organizers, the leaders in our community, the patients who are speaking out about what we are going through, what you are going through, telling those stories and building that movement. I am really, really grateful, and I just want to echo Bernie's thanks for everything that you have been through, everything that you continue to go through, and also for just caring for people in the way that human beings should be cared for. Very grateful to you. Also want to thank Physicians for a National Health Program, Committee of Interns, and you can clap for each one. Committee of Interns and Residents, National Nurses United, People's Action, Be a Hero, and all the other organizations, allied groups in the organizing. Now, I want to share with you that we just found out that tomorrow when we reintroduce the Medicare for All bill in the House and the Senate, and Senator Sanders will be with us at our press conference tomorrow, we will have 112 original co-sponsors. That is more co-sponsors than we have ever introduced the bill with. And I promise you, with your efforts and with our efforts, we will build that up even more, because people are coming up to me in the House and saying, there is no other solution out there. So maybe I still have concerns about this, maybe it's not perfect, but listen, nobody else has a better system, and we know that improved Medicare for All is the answer to our healthcare crisis. Now, we are in the minority, unfortunately, in the House. So we have fewer people in the Democratic caucus than we did last session, but we still have more original co-sponsors. Not only that, I'm very proud to have negotiated to hold the first ever Medicare for All hearings with many of you in this room 2 sessions ago, to now have a Medicare for All caucus in the House of Representatives, to be working with advocates across the country to build a movement to stop the privatization of traditional Medicare, which they falsely claim is Medicare Advantage. That is not Medicare. It is not traditional Medicare. It is a privatization of the system, but also to be continuing to support cities and counties that continue to pass resolutions calling for Medicare for All, even in Republican areas like Dunn County, Wisconsin, which went to Donald Trump in 2020, but just passed a ballot measure affirming support for a single-payer universal health care system. So the momentum is on our side in this movement, and it's easy to understand why. Bernie talked about much of this. 85 million people across our country either uninsured or underinsured. What does underinsured mean? You know exactly what it means. People come into your office, you tell them what they need, you are trying to care for them, and they say, I can't possibly afford that. In fact, 38% of people in 2022 said that they did not get the medical care they needed because it was too expensive. That is 12% higher than even just the year before. So that is what it means to be uninsured. That's not to mention the millions who are drowning in medical debt and the millions who are one broken bone, one car accident, one new prescription away from medical bankruptcy. An estimated 68,000 people die every year solely because they can't afford health care. That is criminal. It is absolutely criminal. And I know I'm preaching to the choir here, but that's 68,000 families missing loved ones, 68,000 stolen birthdays, 68,000 lives that are taken too soon. And COVID-19 made it crystal clear what happens when you have a healthcare system tied to your job. 27 million people lost their jobs and lost their healthcare. So tonight, we have healthcare professionals in the room, on our panel, doctors, nurses who have been through hell and back trying to take care of patients, only to see billing codes and administrative burdens put in the way of saving lives. That's why we're seeing too many incredible healthcare professionals, and I know there are probably many of you in the room, because I've heard from many in my district, who are choosing to leave their beloved profession because they're working in a system that they cannot have faith in, that does not allow you to do the jobs that you need to do. Instead, that money is going to CEO salaries, it's going to stockholders, it's going to people who are profiting off of pain. And I'm going to present to you that we don't have a healthcare system. We call it a healthcare system, but it's not a healthcare system. It's a collection of for-profit centers with varying quality of medical care where idea is really to gain profit out of the system, not to take care of people. Our improved Medicare for All system would be a system. It would be a transformation. It would mean that every single person has the health care they need when they need it. It would mean that we would prioritize preventive care. Instead of thinking, you know, I shouldn't go to the doctor because I don't know what it's going to cost. You would say, I'm going to go to the doctor so I can get it before it becomes something serious. We already know that so many seniors wait until they turn 65 and they get their Medicare to be able to go and get the cancer screenings they need, and by then it's too late. So Medicare for All is a system of health care that prioritizes patients, that says you can get the care you need when you want it, no premiums, no copays, no deductibles, and you get it all. You get it all. You get mental health care, you get reproductive care, you get dental, vision, and hearing, because yes, your eyes and ears and teeth are part of your body and they should be taken care of as well. We would save so many lives and alleviate so much suffering and uncertainty and help people through the toughest times instead of worrying about what bill they're going to get stuck with. But we'd also save an enormous amount of money, by the way. 95% of households would save money on a Medicare for All system, and our country would save over $450 billion on health expenses annually, because we spend double what every other industrialized country spends, per capita and as a percentage of GDP. And yet we don't have the quality of care. So at the end of the day, we know that healthcare is a human right, but it's not just a right. It's actually what you deserve. It's what people deserve. It's what people should have. 70% of the American public is with us, Democrats, Republicans, independents, but the lucrative state of healthcare profiteering in America today means that those thousands of for-profit lobbyists, now you know they're not coming to see Bernie and I, but they are at every single door, and they are fighting our efforts. And let me tell you, they're putting more and more money in. You know why? Because we are successful in talking to the American people about what needs to be changed and why we need Medicare for All. These campaigns are all bankrolled by big pharma, by private insurance companies that are looking to privatize Medicare as we know it today and to make money in any way they can, even if it means putting AI into the ways in which they take care of patients and look at patients and when somebody needs to be discharged or not. Now, I know that it can sometimes feel like we're pushing boulders up mountains, but know this, we have made incredible progress, and we will continue to do that work across the country. And the single most powerful thing as an organizer, I know this, is the people we have building the movement. the people we have building the multi-generational, multiracial movement across this country, doctors, nurses, healthcare professionals, everybody who is participating in this system and knows it is wrong, knows that what we need is healthcare for all as a human right, nobody out, everybody in. So thank you all so much. Thank you to our panel, and let's have this great discussion tonight, and let's get this done. Right, Bernie?
Let's do it. Thank you, Pramila. We have a great panel of healthcare practitioners. Our first speaker is Nancy Haggins, RN, who is the newest member of the National Nurses United's Council of Presidents with over 3 decades' experience as a practicing nurse. Nancy is also the president of New York State Nurses Association, the oldest nurses union in the nation. Nancy, thanks so much for being with us.
Thank you. Good evening, and thank you, Senator Sanders and Congresswoman Jayapal for inviting me to take part tonight. My name is Nancy Higgins, and I'm one of the president of National Nurses United, the largest union and professional association of registered nurses in the country. NNU represent more than 225,000 nurses nationwide. And I am also proud to be the president of the New York State Nurses Association. An affiliate of NNU representing 42,000 nurses in New York State. I've been working as a critical care nurse at Maimonides Medical Center in Brooklyn for over 35 years. In that time, I have seen a lot. I have seen a lot of patients suffer because they didn't have health insurance, so they didn't get the care that they needed. I have seen a lot of patients who have health insurance, but who couldn't afford the cost of the high deductibles and copays, so they didn't get the care that they needed. I have seen a lot of people forced to choose between taking their medication or putting food on the table for their children. My hospital is a safety net hospital in Brooklyn. We care for people in low-income communities and in Black and brown and in immigrant communities like myself. These communities suffer because our current system discriminates on your ability to pay, what kind of job you have, or if you have a job at all. I worked throughout the worst days of the COVID-19 pandemic. Even during a public health crisis, healthcare corporations prioritize their own profit instead of trying to save lives. It was a disgrace, and more than 1 million people died as a result. The primary responsibility of registered nurses is to protect the health and the well-being of our patients by providing safe therapeutic care at the bedside and being an advocate for those patients. As a nurse for more than 3 decades, I know without any doubt we must have Medicare for all. The health of our country depends on it. And thank you. I'm looking forward to our discussion this evening.
Our next speaker is Dr. Adam Gaffney. He is a physician, public health researcher, and advocate. Dr. Gaffney practices pulmonary and critical care medicine at the Cambridge Health Alliance and is an assistant professor in medicine at Harvard Medical School. He's the former president of Physicians for a National Health Program. Dr. Gaffney.
Thank you, Senator Sanders. Thank you, Representative Jayapal, for your leadership on this incredibly important issue. So let me cut to the chase. We need Medicare for all in this country for one reason. It is the solution to the inequities and the injustices of our healthcare system, and no other reform is. The injustices. What am I talking about? Well, let's just start with the 28 million people who were uninsured in 2022. That number is an understatement, however. Actually, over the course of 2 years, about 1 in 4 adults under 65 will have a lapse in coverage, will have a period being uninsured. As a critical care physician, I have seen the results of this. I have seen patients with life-threatening illnesses due to chronic conditions that were treatable but were not treated because those patients lacked access to care. Medicare for all will solve that. But the reality is, probably even a more common problem facing American patients, American households, is underinsurance. We're talking about copays, deductibles, coinsurance, narrow networks, surprise medical bills, medical bankruptcy, medical debt, all of these things. All of it unnecessary, okay? The fact of the matter is that about 1 in 4 working age adults in the United States are classified as underinsured. And again, I've seen the results of that. Patients with chronic lung disease who don't take their inhalers. Because why? Because they are trying to save money. We published a study last year that found that 1.3 million adults with diabetes in this country ration insulin due to cost. Again, that's something that can be seen in the intensive care unit, a life-threatening complication by the name of diabetic ketoacidosis. Again, Medicare for all would solve that and make that a relic of the past. And to conclude, there's inefficiencies that we also have to talk about, okay? The fact that our private health insurance system imposes gargantuan waste on this country. It is lighting money on fire. The Congressional Budget Office estimates that simply simplifying our health financing system with a Medicare for all reform would save more than $400 billion a year, more than enough money to provide full coverage for every single person in this country. But that number doesn't speak to the day-to-day burden facing physicians, nurses, and patients. Physicians spend inordinate amounts of time fighting to get care for their patients, and patients spend collectively hundreds of millions of hours a year on the phone arguing with insurers. 1 out of 4 go without needed care due to administrative burdens. So again, why do we need Medicare for all? One reason: it will fix the problems of our healthcare system, and other reforms will not. Thank you.
Our next speaker is Dr. Sanjeev Sriram, who practices general pediatrics in Maryland at a federally qualified health center. Dr. Sriram is an at-large board member for Physicians for a National Health Program and a senior advisor for Social Security Works. Doctor.
Thank you, Senator. Thank you, Congresswoman, for inviting me to speak. You know, people, when they ask a pediatrician, so, you know, we're doing right by kids, right? I mean, like, isn't it grown-ups who are having the hard time in healthcare? And it's like, no, let's not let the smokescreen of what's going on with high rates of insurance for children fool us about what's going on with kids. This past winter, I had to shepherd kids through a triple pandemic: COVID, flu, RSV. Across the country, millions of kids had to wait in ERs and in hallways because there weren't enough pediatric ICU beds. There were not enough ward beds. Why? Because pediatrics does not make a good business case to the private equity firms swallowing up one community hospital after another after another. Now, I also had a lot of patients where they were fortunate enough not to have to need the hospital bed. They were going to try and recover at home. But these parents then go to their local drugstore only to find out there's no Tylenol on the shelf, there's no Motrin on the shelf. There's a shortage of basic drugs during cough and cold and flu season as if the drug companies have never heard of November, December, and January. And again, I hear the excuses, right? All the business excuses, supply, demand, da-da-da. And the thing is that it's nonsense because it tells you that corporate greed and profits are the center of the healthcare system, not the kids, not the patients, not the families. And now, after having endured all of that, emergency pandemic policies are ending. Some of you may have heard that Medicaid is going through an unwinding, a redetermination. What does this mean? This means that Medicaid is now required to scrutinize families about how much money they make, who is in their household, where do they live. And if you don't pick up the phone, if you don't fill out the forms correctly, your kids are going to lose Medicaid, and this will hit children, people with disabilities, and communities of color harder than anybody else. And for what? Your family made a little bit more money this year compared to last year. Your family moved and forgot to tell Medicaid that you had to change an address. Now, I work in Maryland. My state, my clinic, they're doing their best. But I know that I'm going to have kids who are going to lose their coverage because there's going to be some natural human slip-up in paperwork. There's going to be somebody who says, oh, Mom, you picked up that extra shift. You don't qualify anymore. But you do qualify for an opportunity to hand over more of your money to this insurance company. This is not a healthcare system that is putting the kids, the patients, the families at the center. It's about protecting the business. We have a corrupt and illegitimate Supreme Court that just wrecked abortion care. They've got birth control on their next target. We've got state legislature after state legislature going after gender-affirming care. I'm proud to be a pediatrician providing gender-affirming care to my trans youth. But increasingly, doctors like me are getting stuck between our patients and some bigots in a legislature or in a court trying to tell us that what science has struggled to put together for kids who have been struggling with their own body and their sense of who they are, that all of that scientific work, all of that brilliance is illegitimate somehow. These are the reasons why I'm fighting for Medicare for all. I'm sick and tired of being used as a pawn by the insurance companies. I refuse to give substandard care because some insurance company joker says that I'm not in network. I refuse to do substandard care because some bigot in the legislature pretends that they know better than I do about protecting this kid's life. I refuse to be that pawn. I want to be the healer that I said I was going to be at the beginning of this journey. Now, I know that this country has an ugly habit of demanding people like me forgive and forget. That, you're supposed to forgive these kinds of instances of the pandemic. RSV, COVID, flu hit you. That was, that's a bad winter, doc. Oh, hey, Tylenol and Motrin is back on the shelf again. Forgive and forget. I refuse to forgive. I refuse to forget. I will fight. I will fight for Medicare for all, and I hope you will too. Thank you.
Dr. Natasha Driver is an obstetrics and gynecology resident at Howard University Hospital in Washington, D.C. She's dedicated her career to serving underserved populations with a deep understanding of the complex intersection between healthcare and poverty. She is an OBGYN department representative at Howard University Hospital on the Committee of Interns and Residents. Dr. Driver.
Thank you, Senator and Congresswoman, and thank you for all coming out tonight. My name is Dr. Natasha Driver, and I am representing the Committee of Interns and Residents, the largest national union for medical residents. I am also a first-year OBGYN resident here in Washington, D.C. at Howard University. For those of you who are unfamiliar, the beginning of medical school starts with a tradition called the white coat ceremony. This is when we take the Hippocratic Oath, a declaration of our commitment to the ethics of medicine. For me, this oath has meant taking care of underserved populations, and I have already served hundreds of patients whose health is complicated by poverty, racism, and immigration. According to my oath, illness may affect the person's family and economic stability. My responsibility includes these related problems if I'm to adequately care for the sick. This can often be a challenge. One of my patients, let's call her Sohaila, is a 29-year-old woman who works in the often precarious service industry where her employer does not provide her with health insurance. When I first met her after delivery, she refused treatments which were part of routine postpartum care for the simple reason that she couldn't afford them. This is a regrettable and all too common occurrence in the practice of medicine, especially for those of us who work with the underserved. Medicare for All would help to reduce the problem of uninsurance and allow me to adequately care for my patients. Sohaila is just one patient whose story represents how our current healthcare system limits the ability of doctors to fulfill our Hippocratic Oath. By adhering to the principles outlined in the oath, physicians can be trusted to act in the best interest of their patients, and patients can feel reassured that healthcare providers are committed to providing the best possible care. This is the reason why a commitment to Medicare for All is also a commitment to the Hippocratic Oath. Thank you.
Our next speaker is Jennifer Coffey, who is from Manchester, New Hampshire. She's a member of Rights and Democracy, the People's Action affiliate that covers Vermont and New Hampshire. Jennifer is a breast cancer survivor diagnosed with complex regional pain syndrome. Jennifer spent years struggling to make sure her doctor's visits and medicine would be covered by her insurer. She is also a former Republican state representative who, through personal experience, now understands the need to move toward a Medicare for All system. Jennifer?
Good evening. My name is Jenn, and I'm from Manchester, New Hampshire. And at one time, I was a fully functioning EMT, and I joked that I lifted people for a living. Then breast cancer surgery went wrong. I ended up bedbound for 2 years, and I lost everything. I felt like I was going to be trapped forever in my bedroom. I developed complex regional pain syndrome, the most painful disease known to medicine, and small fiber neuropathy. Rules imposed by my private health insurance company, United Healthcare, Medicaid, Disadvantage, consistently overrides my care team's medical expertise. I've yet to figure out how my private health insurance can actually help me. Because my private health insurer refuses to cover my care, I was forced to make a GoFundMe and sell my possessions to afford treatments. With the help of People's Action's Care Over Cost campaign, I was recently able to get approval for my next infusion. I worry, though, that when no one is looking, United Healthcare will not approve any more treatments. Things got bad really fast last year. My illness was progressing, and I was forced to ration infusions because my rent was hiked up $400. My neurologist started me on LDN, low-dose naltrexone. But the pharmaceutical company that makes the medication will not make it in the low dose that I need because it's not profitable for them to do so. I've had to use a compounding pharmacy to get the medication, and I've had to use 5 different pharmacies in order to keep costs down. Again, my Medicare Disadvantage plan through United Healthcare will not cover it. Insurance companies serve no purpose in medicine. They decrease positive outcomes. America has arguably the best medical care in the world, but only if you can buy it. This is not a Democrat or Republican issue. This is a human issue. It's disgusting to watch United Healthcare brag about over $8 billion of profit earned in just 3 months, and they deem me too expensive to keep alive. I'm excited about this work. Anyone who needs care will get it, no matter who they are, no matter where they're from. Right now, there are millions of people across this country who are organizing, and we want Medicare for all now.
What we're going to do now is have a little discussion among the panel, then we'll open it up for a few questions and comments. All right, let me start off. All of you are practicing professionals. You're out there every day dealing with patients. Talk a little bit about your experience with patients who walk in the door, who are uninsured or underinsured, and what impact that lack of insurance has had on their lives and your ability to provide the care that they need. Who wants to jump in on that one? Please.
As a nurse, I have to say to you, we have the front row of the devastating cruelty. I have multiple of examples when a patient's come in. I had a young man who came in because he was having pain in his leg for months, and then when we said to him, why didn't you go to the doctor? He said, my co-payment was $50 and I couldn't afford it. He ended up with stage 3 bone cancer, which was preventable if he didn't have the high co-payment. We had another young woman who was bleeding and decided, you know what, she needed to feed her children. Then by the time she came in, she had stage 4 ovarian cancer. Also because of lack of care. You know, we come from a community where we also have people that are uninsured, also that are undocumented. At a young patient, because he was undocumented and was afraid that he was going to be deported, he had a toothache. So what happened, he ended up with a brain abscess, and he, yes, did not survive, just for simple care. I could give you a million of examples, what we see every day as nurses, doctors, all of us working in the emergency room, asking patients, you know, what happened. Or sometimes they walk in the room, they'll tell you without even you asking. The reason I didn't come, I couldn't afford it, or I had to wait 3-4 months, or I had to wait to the clinic, or I couldn't get childcare, or I couldn't get off work. So we see it every day. That's the reason we know, I know as a nurse, Medicare for all is what we need to stop the cruelty, to continue to care for our patients.
Anyone else would like to say a few words on what you're observing in your practice?
I often have women come to see me for contraception. They desire a specific form of contraception that will be effective for their healthcare situation. However, often when I see these patients, I have to run their insurance and see what they will cover. Most of the times, I have to break the news to my patients that they just won't be able to receive the coverage. This leads to my patients having to compromise in what medications they will accept, and it's also a compromise because I know I'm not able to provide my patients with care that is meeting their condition.
Yeah, so I take care of a lot of families where there's a lot of mixed immigration status. So just to give you an example, I have a family of 5 that I'm thinking of. The oldest child was born in Central America. The second one was born in the United States, but in a state that did not expand Medicaid and that went uninsured for most of their childhood. The family moved to Maryland, where the youngest child is born. Mom and dad's immigration status is also mixed. Mom is in the process of getting citizenship. Dad is undocumented. And so these are 5 people who have been fragmented by our healthcare system, all having 5 different interfaces with healthcare, all of them, I mean, just barely holding their head above water. And really, I would say the parents are drowning with, not getting their healthcare met. And it's simply because their humanity wasn't enough eligibility for the system.
Let me switch gear, if I might, and talk about how much time and frustration you have in dealing with insurance companies who are making it difficult for you to provide the treatments you want for your patients. Who wants to talk about that one?
Well, I would make a couple points in response to that. First off, if you speak with any physician, they will talk about the enormous amount of time they spend on documentation, the electronic health record, billing and coding, and all of these activities that are really geared towards payment and not geared towards care. The reality is this translates into an enormous burden of cost on the healthcare system in the United States. On average, we spend about $80,000 per physician just to cover the cost of their interactions with insurance companies, 4-fold higher than Canada. In the hospitals, our hospitals spend about a quarter of their revenue to cover the cost of armies of billers and coders to interact with insurance companies and chase after patients and so on and so forth. And that's twice the proportion of Canada. So again, there are an enormous amount of waste, there's an enormous amount of savings that we could use to actually cover everyone. And that's what we need to do.
It's interesting. I talked recently to a conservative Republican physician, and he said he would not recommend to the younger generation to get involved in the profession precisely because all of that paperwork and their inability to practice the kind of medicine that they want. Yeah, Pramila?
Bernie, when I was trying to build support from public hospitals for Medicare for All, I spoke to the head of a major public hospital, and he told me that they have 200 employees whose only job it is to fight with the private insurance companies to try to get the care that they have prescribed for their patients. So you imagine even what it takes for a hospital system to just be able to try to fight for the care that people bring. And I think it just shows how the costs line up on every single level. But also, I have many friends who are doctors or nurses who are leaving because they feel like I'm seeing so many nodding heads, they feel like they're spending 70% of their time arguing with people, and it's really what Sanjeev said, arguing with people to say, I am the doctor, I am the nurse, I know what my patient needs, and you are saying it's not possible. And that's just unacceptable.
My last question before we open it up is, what do you think it would mean for the health and decreased anxiety in this country if anybody could walk into a doctor or nurse's office whenever they felt they needed to without having to worry about how they're going to pay for it? What would it mean to the health and well-being of our country? Who wants to say a word on that one?
May I?
Yeah.
In my opinion, that would give me true medical freedom, where I am making the decisions with my providers and my family, and whatever is needed is done, and not some bureaucrat insurance person or computer denying care. The decisions about care needs to be between the physician and the patient and their family, and that's it. Medicare for all is the only way to do it.
Further discussion, what would it mean if people said, hey, I'm not feeling well today, I'm going to walk into the doctor's office?
I think to me, one of the most important things that it would mean for us as a society is that we would finally be dismantling these notions of, are you worthy? Are you deserving? At a time when, because it's like anybody working in healthcare knows, right? I mean, like, you know, the illnesses and the diseases are hard enough. They take it out of you enough, right? And then you, on top of that, you're being put through this system that says, well, you're worthy of this, you're deserving of that, you're not really quite deserving of this next piece. And to know that, like, you know, your humanity is enough, that was all you needed to get through the door. I tell people to imagine, like, you know, I mean, I take my daughters to the public library, right? And it's like nobody is scrutinizing that, oh, your dad is a doctor and he makes such and such amount of money, so you're eligible for getting these kinds of books, but not these kinds of books over here. If you want to get these, you know, these services, you need to. It's none of that, right? Like, you walk in and you get to, like, you know, I mean, have, like, you know, just explore your mind in your education. I would love to see that for healthcare, where you're able to just walk in and get what you need without having to worry so much about the bill that might come later.
All right, yeah.
It would, you know, as a nurse, it would help us to care for our patients. And hospitals, hospital corporation would actually put patients over profit. Human beings would be better, you know, being treated better than a profit. Because right now, hospitals are a corporation. It's not, it's a business. So as a nurse, that's why we are frustrated. And we want to do more for our patients. We want to spend time for our patients. We want to deliver proper patient care. But with the system that we have right now, we cannot. So it would put patients over profit.
When we think about a cruel and dysfunctional and broken system, one of the things that just comes to my mind is that somebody ends up in a hospital with a serious illness. Maybe it's cancer, heart disease, whatever it may be, and they come out with a huge bill, and they can't afford to pay the bill. Because they were sick, their family now goes bankrupt. Can you imagine being punished financially? Bad enough to deal with cancer or heart disease, but to be punished for the rest of your life because you can't pay the bill. That's the system that we're talking about right now. Okay, what I'd like to do is, we have time only for a small number of questions, but if people want to jump up and be loud, we'd love to hear it. Yep. Do we have a mic? All right. Ms. D. She's a former runner. She'll get to you. Okay.
Hi there.
Stand up if you could. Give us your name.
Is it on? Oh, hi. My name's Shelby Warren. I'm a medical student, also a current business student at Johns Hopkins and a SNAP member with PNHP. So my question is, if you look at a healthcare system, you know, the amount of money that a healthcare system spends, some systems put a lot more into preventive care and low-cost technology, right? Cuba is an extreme example of that. Other countries like the United States, we put a lot of money into high-tech costs, you know, technology that may not actually increase the outcome of the healthcare that much, right? America is a good example of that. So how does the Medicare for All financing system take into consideration the fact that America, we are a country that really invests a lot in high-tech, high-cost care that really doesn't produce really great healthcare outcomes? We're really focusing on late-stage disease. There's a lot of money in that market. Where does Medicare for All fit into
Well,
that?
the current system profits off of what you described.
Correct.
It's really good for the insurance companies and the hospitals. What a Medicare for All system does is not only provide care for all people, it runs it in a cost-effective way. And the most cost-effective way that you can run a system is keeping people healthy, preventative health care. If you had nurses in every school in America picking up on the early diseases that kids have, if you provided dental care for all, if you had, right now, as I mentioned earlier, we are spending about 5% of our healthcare budget on primary health care. Other countries spend 2 or 3 times with what we spend. So I think what Medicare for All does, it tries to keep people healthy, not make huge profits for the drug companies and the insurance companies. That's the difference. Okay. I see a hand right there. Yes, ma'am.
My name is Marissa Lee. I'm a labor and delivery nurse, and I want to give you an example of what I saw for a pregnant patient that I had. I had this patient that had health care, but again could not pay for the deductible. So she came to the hospital once a week to get her baby checked, and she told me, and the nurses were saying, why is she coming? I finally asked her. She told me, I don't want to quit my job, and I don't want to go in the system, but I want my baby to be all right. She shouldn't have to go through that.
That's right.
She shouldn't have to. No one should have to go through that. And we see it every day as nurses and as doctors, as anybody that works in the medical field sees it every day. I support Senator Sanders. I support you from the day you started, and I'll support you till the day I die. But we need Medicare for all.
Thank you. Hand right here. Yep.
Hey, good evening. Thank you all for giving us a chance to listen here and hear your thoughts. My name's Liz. I use they, them pronouns. I'm a third-year PEDS resident at Children's. And I just wanted to kind of talk, we're here with CIR, the Committee of Interns and Residents, and one of the things that's really hard about being a resident, and as most of you guys know, is we work really hard. You know, the rule is we have to work fewer than 80 hours a week. You should know they average that over the month, which means you can work more than 80 hours in a week. But most of that work, and I imagine my co-residents feel similarly, actually goes to making money for the hospital. Most of that work we're doing is we're putting in documentation, we're putting in order so that the physician who's supervising us, the attending, can then bill and make sure that the hospital remains profitable. Right. So I guess my question to you guys is, how have you thought about how this might intersect with medical training, since right now CMS Services does pay for most residency spots in GME funding, thinking about standalone children's hospitals as a separate issue? How have you envisioned how this might intersect or improve the experience of residents in their training transitioning to Medicare for all?
Anyone want to take a shot at that?
I would say there's a lot of policy questions wrapped into that one question. I mean, there's a few things just thinking about student, resident, work-life balance and all that I think pertain to the Medicare for All discussion. First of all, when we put out our last reform proposal for Physicians for National Health Program, physicians' proposal for single payer, we did call for full subsidization of health professionals' tuition. I think it's not exactly a question, but I think it's a really important part of creating a just healthcare system. There's no reason that you should come out in debt and face those problems. I think the other thing is that Medicare for All, and I think Senator Sanders alluded to this, it gives a robust toolbox. It doesn't just change who pays for health care, but it changes how we pay for it. And it can rejigger the entire system away from profit-oriented activities. It can give hospitals lump sums so that they can focus on the care that's needed, not necessarily what's profitable. And I think that could fundamentally change the orientation, the services, and yes, the treatment of employees, and including residents. So that's a little bit, try just to touch on a couple of the issues you brought up.
I'll just build on that too and say that within the Medicare for All framework, the way the bill is written, hospitals also would not be trying to bill for the things that bring them the most profit, right? They would get a certain amount of money. They would be able to assess kind of what is the need generally based on the conditions they see, and that's the way that they would get their money. So they also would have a very different incentive on what they're asking people to do. Maybe you could actually do your jobs instead of trying to do the jobs so that physicians can get billed for whatever it is that they're doing. So I think we really are talking about a whole different way to look at healthcare, and to start with the premise that we want to take care of people, that the entire system is designed to take care of people, not to try and make money for private insurance companies, pharmaceutical companies, even private hospitals, right? So that is fundamentally different. The second thing is, because we are, as was said earlier, because we're focusing on preventive care, and the the people that come in will also be looking for different things. And I think that is also really important. We'll have a much smaller group of people that will need that kind of curative care. We will have it, of course, but we're going to be able to take care of so much at the very beginning. And people are not going to have to, the question is not going to be, can I pay for it? How many people hear that as the first question when you tell somebody what they need to do for their health, right? Can I pay for it? The question will be, will it make me well? And that's what we need.
I should also say, in terms of residents, we're seeing throughout this country a significant uptick in trade union organizing. People are coming into unions. And I can tell you that at the University of Vermont Medical Center in my city, and all over this country, we're seeing residents saying, you know what, we don't want to work 80 hours a week and make $62,000 a year. And they're forming unions and fighting back for good wages and good working conditions. And I think that's a step forward. Okay, I see a hand back there. Stand up, ma'am. Yeah, okay. Let's get her, mic is right there. No, you, take in the red, then we'll go to the one in the black t-shirt. Yeah.
Hi, my name is Angela Rogers-Poole.
Hold that mic closer to your mouth, please.
My name is Angela Rogers-Poole, and I'm a nurse at the MedStar Washington Hospital Center. I actually typed my question out. So, while I agree with everyone here that every human being should have access to quality health care, but I'm asking this question from the view of not just a bedside caregiver, but I've also been an administrator and a patient. When the Affordable Care Act was implemented, it became evident that the infrastructure of our healthcare system was not taken into consideration because the healthcare industry was not prepared to accommodate the influx of the additional 10 million plus patients. Our emergency rooms were bursting at the seams. The staff had difficulty providing quality care because multiple patients were screaming legitimately for help simultaneously. Somebody shared some stories. My personal story is my mother was a member of an HMO. She had a mass on her ovary. Because of a glitch with the HMO, they told me, your mother has to wait 6 weeks to have her surgery. Because I know certain things about the healthcare system, I said, well, if you can't accommodate her because you only have one of her gynecological oncologists in the region, then you can pay for her to go out of the system. As a result of that, she had her surgery a week later. And I just wonder how many other people who don't have advocates for them had to suffer and or may not have survived the surgery. So as a result of that, I'd just like to know if you could please tell me that with your current plan, what plans do you have included in your proposal to enhance the infrastructure so that these things don't happen in the future if and when your bill is passed?
Well, thank you. That's a good question. And this is what I predict. The day after Medicare for All is passed, you know what? We're going to have millions and millions of people coming out of the woodwork who for years had wanted to get health care, who couldn't. But we're going to plan for that. And that is why we need to substantially increase the number of doctors and nurses and dentists and everybody else. And by the way, again, the idea that today there are people who would love to be a nurse, to be a doctor or a dentist, and they're saying, you know what, I don't want to leave school hundreds of thousands of dollars in debt. So we have to address that issue as well. If we want young people to go into the medical profession, which we desperately do, we've got to make graduate school tuition-free or substantially reduce the cost of education. Yep.
Good afternoon. My name is Joyce Means. I'm glad to be here today with you through the Center for Popular Democracy and its affiliate, Arkansas Community Organization. just to make sure I understood correctly, are you saying that Medicare for all will fund itself when we have healthier people by way of preventative care?
Absolutely. Not only, look, this is how crazy the system is right now. First of all, people, as you've heard from our panel, they delay going to the doctor's office when they should. So they walk in much sicker than they should be. They end up at the hospital at astronomical cost. People cannot afford prescription drugs, which in some cases cost a manufacturer a few dollars to make. So people become sicker. They end up in the emergency room. They end up in the hospital at great expense to the system. Yes, allowing people to go to a doctor's office on a regular basis, focusing on disease prevention, treating people when they are initially sick, saves huge amounts of money. Absolutely.
Thanks for letting me share.
Yep.
We can pass this up. I wrote, and I'm sadly from Florida. Don't hold it against me. But there's something on here. I'd like you to read it. But the one part that I'm going to bring up, when you sat there and talked about we do need more healthcare providers in the system. Student loan forgiveness for RNs, 117th Congress, who's keeping count? Most hospitals are for profit, and we've discussed this. The Public Service Loan Forgiveness Program, it's excluding almost all of us here, almost all of us, because it's a for-profit system, and it's at the point that even with the federal county, oftentimes when it comes to the medical staff, I worked at a prison, medical, they outsourced me. So because I was outsourced as medical, guess what? I'm stuck with those student loans. And in my homeowner's insurance just literally went up 450% in this year. And the student loans are going to be coming back. I'm going broke. I shouldn't go broke. And we've got to do something. So you want more, doctors, nurses, dental hygienists. We've got to expand this program. It can't be just for nonprofits, because as a whole, we treat the public, we treat the community. And imagine if all of us were to just jump up and go to VA, nothing wrong with VA, please don't misunderstand what I'm saying, and there would be nobody left in the private sector to deal with our community hospitals. But would you guys, pretend we're in middle school and pass the note forward, please? Thank you.
Thank you very much. Anyone wants to comment on anything anyone's saying? Okay, other questions? I see a hand right here, ma'am. It's a mic right behind you.
Good evening. I'm Bernadine Ingeldorf, recently retired, excuse me, nurse from Minnesota, and I'm grateful to be here. I worked for many years in psychiatry or mental health, and nobody's made comment about the impact on our country with mental health, and we know we're in a crisis right now.
I had, Pramila can say a few words as well. In the last couple of months, I've been to many schools in Vermont, talking to young people and talking to teachers. And what teachers are telling me is that not so many years ago, they actually taught English, they taught math, they taught Spanish, whatever it was they were teaching. Now they're spending half of their time just working with their kids who are dealing with all kinds of anxieties and depressions, addictions, and worse. And I was in a high school where a kid overdosed in the bathroom, what that meant to the whole school. So, of course, we have a mental health crisis, and part of a dysfunctional healthcare system is we have nowhere near the capability of addressing that crisis. In Vermont, we do better than other states, but I suspect in every state in this country. If you're in a mental health crisis, you want immediate care, it's going to be pretty damn hard for you to find it. And if you need long-term care, you're going to have the insurance company say, well, we think 6 visits will be enough for you. We've determined that. We've done a deep analysis of your problems, 6 and you're out. All right. So as part of rebuilding our healthcare workforce, obviously, we need more counselors, psychiatrists, psychologists, child psychologists, social workers, et cetera. No question about that. Anybody else want to comment on the mental health crisis?
I just wanted to say the same experience that I'm having in the district. The number one thing I hear about is mental health. Number one, on top of costs, of course, and just the struggles of everyday life. And I think that in Medicare for All, what we've done is we've included the things that we know are essential to taking care of health. So that is mental health care, that is long-term care. Things that have not been included before are in Medicare for All, because our belief is that all of these things have to be covered. And we also know that what we've been talking about with all of you, we need more mental health therapists, more counselors, because there's no access. And telemedicine, telehealth was good during COVID because it gave people who didn't even have a mental health provider in their rural area the opportunity to at least talk to somebody, but we need people in every place across the country. And so that is, part of it is if you build a system that actually has the demand taken care of, right, where people can say, hey, I can afford mental health care because it's covered, then people will ask for mental health, and then we will get more people going into the field if we pay people well. Also wanted to say, in response to the question that was asked from up there about costs, it is, of course, that we will have people healthier because they'll have preventive care. But also, let's be clear that in our current system, 30 to 50%, depending on how you calculate these costs, are going into the pockets of private health insurance companies, drug companies, all the private actors that profit. And when you take that away, and you have a government-provided insurance card, that's really what we're talking about, is a government-provided insurance card, then that level of profit is going to go away. Now, I'm sure that they will find other ways to make money. I am convinced that that will probably happen, and we will have to figure out how to deal with that. But a huge percentage of our costs today are not going into patient care, as you very well know. They are going into the pockets of people who are profiting off of people's pain. That will end with Medicare for All.
Okay, it's getting late. One last question right here, ma'am. Yep, stand up. There's a mic coming.
Hi, I'm Rachel Hanneman from the M&A in Minnesota. Just to kind of expand on what we were just talking about with accessibility, you were referencing the teachers and how they're spending a large portion of their time just with this ancillary support to other parents. With this Medicare for All, would there be provisions or expectations that we could start putting some of these resources into the school so that our teachers can focus on education and that we could have those counselors and whatnot on site to maybe help maintain? Because as a single mom, it's very difficult to balance work and getting my kids to their appointments and to their on-site needs.
The answer is absolutely. I think there are very few schools in this country who have the kind of staffing in terms of counselors and other staff that they need. And, there are schools in this country where your guidance counselors, where your nurses are just overwhelmed with the amount of work they have to do. So if you want to be smart and save money and ease suffering, you put the nurses and the counselors in schools as quickly as we possibly can. All right, let me do this and just say this. This fight, again, in my view, is not a healthcare fight. I think it is virtually impossible for anybody to defend a system which is so expensive and leave so many people uninsured and underinsured. And very few people do try to make that defense. What our fight is about is a political fight. It's an economic fight. It's a fight that requires us to take on extraordinarily powerful special interests who really could care less if people live or die, whether they suffer or not. For them, the bottom line is their bottom line. And what I want to say as an elected official is at the end of the day, it's not going to be Pramila and I who are going to help lead this fight. It's going to be you. It's going to be the healthcare professionals. It's you who are going to tell the American people that you want to serve them, and the system prevents you from fulfilling the Hippocratic Oath and doing what you have got to do. And the good news is that what we're seeing all across this country is more and more doctors' organizations and more nurses' organizations and numbers are saying, you know what? We can't do our job under this dysfunctional system. Our job is to treat our patients, not to make money for the insurance companies and the drug companies. So there are many of us here in Congress who look forward to working with you to finally do what is so long